Do you need a Medigap plan if you already have Medicare Parts A and B? Well, it is an extra expense, but consider that with only original Medicare benefits as your coverage, you would be responsible for paying 20% of all of your outpatient services. It also means shelling out money for deductibles and copays related to hospital stays and skilled nursing care. Let's dive into whether you need a Medigap plan. If you think about health insurance coverage that you've had in the past, you probably remember that it didn't cover 100% of all your healthcare costs. Most plans here in America have deductibles that you pay first if you go into the hospital, and copays that you'll need to pay when you have a doctor visit or fill a prescription. In Medicare, it works the same way. It has deductibles, copays, and coinsurance that you will owe whenever you use your Medicare Part A hospital benefits or your Part B outpatient benefits. The deductibles aren't small either. You'll currently shell out $1,600 in deductible spending if you spend even one night in the hospital. And if you need to recover in a skilled nursing facility after your acute care in the hospital, Medicare pays for the first 20 days, but then you'll begin paying $200 per day thereafter. These costs are daunting enough on their own, however, that's not all. Your Medicare Part B benefits only pay for 80% of your outpatient expenses. Now, if you are fairly healthy, you might think to yourself, you don't mind paying 20% of the cost of a doctor's visit when you only see the doctor once or twice a year. But Part B also covers things like diagnostic imaging, which includes CT scans, MRI exams, and PET scans. It covers ambulance rides, outpatient surgeries, chemotherapy, radiation, and dialysis too. I think we can all imagine that paying 20% of these items could add up pretty quickly. So this is why, of course, Medigap plans, also called Medicare Supplements, same thing, were created back in the 60s. These policies pick up where Medicare leaves off so that you don't have to worry about what kind of bills are going to show up in your mailbox when you get home from a 3-week hospital stay or a long stint in a skilled nursing facility after a surgery or a stroke. The reality is that even if we are totally healthy today, we never know what tomorrow will bring. If Medicare will be your primary coverage and you don't have any employer health insurance or retiree medical benefits that will help you to cover your share of the cost, you'll want to consider some additional coverage to fill in these gaps. Medicare beneficiaries can choose between Medigap plans and Medicare Advantage plans to help them pay for these costs. Here on YouTube, we have other videos about Medicare Advantage plans. So in this video, let's discuss Medicare supplements, which are also referred to as Medigap plans. If you want freedom of access to your favorite doctors and hospitals, you may really like a Medigap plan. People with Medigap plans can see any provider anywhere in the nation. This gives you access to over 1 million providers to choose from, and it doesn't matter which insurance company you bought your Medigap policy from. Your policy will pay on any claim that Medicare approves, regardless of whether you chose a Medigap policy from ABC company or XYZ company. It also makes Medigap policies great for travel. You can see doctors in Florida or Washington or anywhere in between as long as they accept Medicare. Some Medigap policies also come with up to $50,000 of emergency foreign travel benefits as well. Another feature that people enjoy about Medigap plans is you don't have to get a referral from a primary care doctor when you want or need to see a specialist. Medigap policies do not have networks, and they do not require you to designate a primary care doctor. If you wake up tomorrow with a blemish and you decide you need to see a dermatologist on Medicare, you can simply book your appointment and go. And what if you have pre-existing conditions? You might also enjoy how Medigap plans have very predictable back-end costs. For example, a Medigap Plan G will cover all of your approved doctor appointments for the year after you have first met your small annual Part B deductible. This means that even if a health condition is causing you many doctor visits, you don't have to worry about breaking the bank because there are no doctor copays that you will owe. What you are buying when you purchase a Medigap policy really is peace of mind. Medicare gives everyone a one-time 6-month Medigap open enrollment window during which you can buy a Medigap policy without any underwriting or medical questions. This means you will have a chance to sign up for any Medigap policy you want offered in your area when you first activate Part B. So now you know the many reasons why beneficiaries buy Medicare Supplement Plans, and of course you can check out our videos on Medicare Advantage plans as well. And if you are ready for some help with choosing your policy, you can reach out to us today for assistance at 817-249-8600.